Good morning, everybody. This is Kate Carpenter from the Compass HIIN, and I'd like to welcome you to the webinar. Give us just a few minutes as we promote our hospitals in the fishbowl to panelist status. Don Stevenson, have you joined us?
I didn't hear what. Can you see the whole mic?
Don, are you on the line?
Oh, go in there. I think it's over here.
Jill Sandy, have you joined us?
Oh, how do I get on there? Yeah,
I'm here. Dawn's here.
Great, thanks, Don. You go ahead and mute your line, and then you can just manually unmute when we turn to you to talk.
Okay.
Jill Sandy, are you with us?
Yes, we're right here.
Very good. Great, I see that you've popped in. Go ahead and manually mute your line. And you can also disable your video if you wish. Very good, Jill. Dan, have you joined us? Dan LaGrange?
Yes, I'm here.
Very good. We see you. Go ahead and mute your line. And Michelle, are you on the line? Looks like Michelle is on with us, but just still connecting to audio, so we'll give her just a moment there at Clark County.
Good morning.
Good morning, Michelle. Hi, we can see and hear you. Thanks for joining. If you
I have other team members with me too. I've got Liz.
Good morning.
Joe is clear over there. He's
hey,
not
Joe.
closely with us. So.
Very good. Well, you're welcome to use your video, or you're welcome to disable your video for the duration of the webinar. And then also we'll have you manually mute your phone line at this time, and we'll go ahead and get started.
All right. I am going to, now that you've seen us, I'm going to stop our video. Thank you.
Very good. Okay, well, now that we've got all our fish in the fishbowl connected, I want to thank you again for joining. My name is Kate Carpenter, and I'm the manager for the Compass HIIN, and this is webinar 3 for the Swim Towards Stewardship project. The focus of our webinar today is on tracking and reporting. I have just a couple of housekeeping items and instructions for navigating the Zoom platform if you're new to the system. So Zoom is just basically a webinar system, and it has a few functions we'd like you to know about as we get started today. In the middle of the Zoom screen, you'll see a few functions towards the middle. The first one on the left is the chat. We'll encourage you to pull that up and to practice using, go ahead and chat in who you are and what facility you represent. You can use the raise your hand function if you have a question, or certainly use the Q&A to type in a specific question. One mention on the chat, if you do pull up the chat, you'll notice that right where you can type in your message, there's a to box. And we'll encourage you to use that drop-down arrow and select all panelists and attendees. As you may know by this point, we have 4 hospitals participating in the Swim Towards Stewardship Fishbowl, and all 4 of those hospitals are registered as panelists so that they can weigh in to the conversation and ask questions. We also have several hospitals participating from the sandbar in a view-only mode, so we want to make sure that they can see our questions and discussions as they generate through the chat over the course of the session today. We also want to let you know that this session will be recorded and transcribed. We'll be sending out a follow-up email to our Swim Towards Stewardship team leads probably the beginning of next week with a direct link to this recording, the slide decks, and any resources presented. The recording will also be posted on the Innovation Resource Library for those of you that are registered there. So we'd like to welcome our 4 hospitals that are participating in this fishbowl and thank them for their work so far and dedication to this project. We've got teams from Gunderson Palmer Lutheran Hospital, Virginia Gay Hospital, Clark County Hospital, and Keokuk County Hospital. So many thanks to them, and a special welcome to all of those that are joining us from the sandbar today. We hope that you can watch along and learn with these hospitals as they progress through each of the core elements. We do have a speaker today that's joined us, Sarah Durr, who's the medication management lead at the Iowa Healthcare Collaborative. In this role, Dr. Durr contributes to all operations and initiatives aimed at medication management and healthcare. She has an array of experience along the healthcare spectrum, including long-term care, inpatient, ambulatory care, toxicology, and policy and advocacy. She completed her PharmD at the University of Minnesota College of Pharmacy, and upon graduation, Dr. Durr completed a one-year ambulatory care residency at Fairview Health Services through the University of Minnesota Ambulatory Care Program. Dr. Durr served as the inaugural executive fellow at the Iowa Pharmacy Association, where she was engaged in a variety of patient care initiatives, clinical expansion initiatives, policy and advocacy efforts, and advancing the profession of pharmacy throughout the state of Iowa. We'd like to welcome Sarah with us today. As we start this session, we'll begin with objectives. Thank you, Sarah.
Thank you, Kate. Thank you for having me on this webinar today. We will start off with just looking at a couple of our objectives today. We'll start with a brief review of the measures that were on the last webinar, just a refresher of what we might be tracking and reporting on. And then we'll share some strategies for engaging prescribers and frontline staff in facility-specific reports. And finally, we'll describe antibiograms and a basic strategy for creating and implementing an antibiogram. And that's really going to be our example of how we can do some of this tracking and reporting. So not going a deep dive into how to create one or what data you need, but more so a general understanding of what an antibiogram is, and then how we can best communicate if we were to create one of those. So I wanted to start off with a discussion question for our participating fishbowl hospitals. How does your facility currently share antimicrobial information with prescribers and hospital staff? And we will start off with Gunderson Palmer Lutheran Hospital. How are you currently sharing antimicrobial information with your prescribers or other hospital staff? We're not hearing you, so you may need to unmute your line. Okay, well, we'll come back to Gunderson Palmer Lutheran. How about Keokuk County Hospital? How are you currently sharing antimicrobial information with prescribers?
So we really aren't at that point yet. We're still working on our spreadsheets. At what I've been doing as the pharmacist is I have actually been talking with the prescribers face-to-face about how we're trying to approach this. So we're still working on our spreadsheet. We're seeing some definite patterns, but we haven't gotten enough of our information into our spreadsheet yet to feel like we could share the whole thing with them yet.
Wonderful. Well, it sounds like today will be a great way for you to learn some techniques to communicate the information that you are collecting and start sharing that back with some of your hospital staff and prescribers. Thank you for sharing that.
Sure.
Let's go over to Virginia Gay Hospital. How are you sharing antimicrobial information with prescribers?
So currently we do a chart review as pharmacists, and then we'll communicate either face-to-face or via phone on different antimicrobial information, as well as doing some chart review that gets communicated back once every quarter.
Wonderful. It sounds like you've already got a system in place, and hopefully today we can add some additional strategies for you to implement and continue to share with your prescribers. Thank you for sharing. How about Clark County Hospital?
So one of the challenges of a rural hospital is volume. So our creating meaningful data from our antibiogram based on our cultures is really an annual, if it's based on ours. We do have access to Des Moines Antibiogram to look for larger trends, but we're not able to track really closely. We just don't have the volume of cultures to drive it, because the N is so small that it can fluctuate. So what we tend to do is look for, we look at our yearly, and that goes through our infection control committee, and then key trending data is reported to medical staff. And if we have any specifics, then we try and incorporate that on order review in the pharmacy. So most of the communication is to medical staff and pharmacy staff and our infection control person. But in the conversation, the good thing is MedSurg, Liz is our MedSurg manager, and she asked, how do we communicate that to our frontline staff? And the only time that we really communicate that is when we have cumulative data that the infection control nurse attends daily inpatient huddles, and so that's kind of the impact point for staff, for frontline staff.
Great, thanks, Michelle. And let's go back to Gunderson Palmer Lutheran Hospital. How are you communicating antimicrobial information with prescribers and hospitals and the hospital staff? Jill, are you there?
Oh, I'm sorry. Can you repeat that? We were discussing some of the things that you were talking about.
Yeah, absolutely. So how is your facility currently sharing antimicrobial information with prescribers and hospital staff?
Oh, we already answered that. That was the first one.
Okay, we got that.
Okay, yeah.
Sorry.
So just by word of mouth, we haven't gotten all of our data entered in our spreadsheet yet. So I've just been talking, we're so small, we're 14 bed critical access, and so we only have 4 or 5 providers, and I go along and speak with them just face to face, usually on a weekly to every other weekly day or basis. So on important cases that we have to deal with, then I go and talk to them.
Perfect. Thank you so much, Jill. Sorry to have you repeat that.
That's okay, not a problem.
Okay. We'll go ahead and start talking through the content that I have for all of you today, and then we do have a question at the end that we'll kind of bring back and have some discussion not only about the content we covered today, but also how things are going at your hospital currently and where you may need some additional assistance. So as you all are aware, the Joint Commission's Antimicrobial Stewardship Standards for Hospitals, especially for critical access hospitals and nursing care centers, was published in July. And here we're just walking through the CDC core elements. So we'll be specifically focusing in on reporting information on improving antibiotic and antimicrobial use and resistance. So really focusing in on that reporting and how do we communicate that with providers. So as I shared, we kind of talked through some potential measures and reports on the last webinar, and I just wanted to do a quick refresher on these measures that were discussed so that we can talk about how these can be shared with your healthcare staff. And the first one that we kind of looked at was antibiotic utilization. And this was really the focus of the last webinar, where they looked at measures that are critical to identifying opportunities for improvement, as well as assessing the impact of the improvement efforts that you're doing. So the first one there, we have cost is really a big one, looking at total cost of antibiotics, cost per patient day as well, and then cost for antibiotics per admission. So those are all things that you can measure from a cost perspective. Your last presenters also talked a lot about defined daily dose, as well as days of therapy as something that we can look at and measure to better guide what antibiotic use is like in your facility. And then we also looked at standardized antimicrobial administration ratios, or the SAR, and so that's another thing we discussed. Today, we'll kind of discuss a little bit about the antibiogram and how that can inform empiric therapy, or that first initial prescription of an antibiotic prior to knowing what the actual bacteria is. So we'll be looking at that very high level. We also have measures that we can look at when we talk about adverse drug events related to antibiotics. And so when we're doing this, and I believe all hospitals are currently doing this in the HIIN, looking at NCC MERP index for categorizing medical errors and having that be reported as an adverse drug event if necessary. And this is really important to track not only for antibiotics, but all medications, just to give you a good idea of where your adverse drug events are occurring and provide you with some information to monitor and potentially change your processes to have some improvements in preventing adverse drug events. Another measure that we can look at or could be monitored is our C. difficile rate. And the reason for this, or the reason we may want to track this, is to look at how we may be having some adverse events if we're using multiple antibiotics or if somebody comes in with this type of infection that can be quite contagious. Additionally, this adds a little bit more complexity to treatment, and it can be something that we look at the cost of treating a patient that may have C. difficile as well. So that's kind of an interesting piece to that, as there is a national healthcare safety network that does surveillance on C. diff as well as MRSA and other drug-resistant infections. And that's something that your hospital could potentially report to in the future, this network, and then they can provide you some information on drug-resistant infections to better surveil really what's happening across the United States. So those are the four main areas of measurement that I just wanted to refresh you all on before we move on to the next section and the bulk of our presentation today. So we did discuss some potential measures for you to look at your facility, and these are typical measures that antimicrobial stewardship conscious facilities do report on, or at least share back with their providers on these different measures. The key is to tracking the reports and make sure that you have regular intervals and an expectation of pulling these reports. So this could be as frequently as weekly. Oftentimes it's not that frequent. It's typically on an annual or maybe quarterly basis. But just think through what works best for your facility. If you have other reports that you are sharing on a regular basis, maybe following that timeline would make the most sense so that it's something that people are used to seeing. Although this may be ideal to track at the quarterly or monthly basis, it does depend on your facility. So just make sure that you're really thinking about that. And it's important to set the expectation. So make sure that people are aware that this report comes out every quarter or annually, so that they do have that expectation and may start asking some questions about when that next report is coming out. Now, when we talk about these reports, it's great if we're running reports, but we really need to make sure we're communicating reports that we have generated, and just some strategies to potentially do this. We want to be sure when we are looking at reports specific to antimicrobials or antibiotic use that we include overall antibiotic use and trends, not only what antibiotics were prescribed and how they were used, but also the trends of prescribing and use across your facility. You may see that there's more use or less use, or might be consistent use of antibiotics from quarter to quarter or year to year. Start thinking through what bacteria we're treating and what medications we're using for those. And then that really can help prescribers tailor their empiric therapy to bacteria that we know are common in our population. And then looking at interventions made and the progress that came with the use of the intervention. So think about, what was the intervention? Did this intervention provide the outcome anticipated? And what progress was made with this intervention? So going back and reassessing every single time there's an intervention to see if it was something that improves the way that things are used in your hospital, or maybe there's another way that we need to make some changes with it. When you do share a report, it's also key to talk about progress or changes that have been made. So not just saying, here's the report, great, we'll take a look at it, but really thinking about, are we seeing better use of empiric therapy? Are we targeting the organisms appropriately? And how is the number of days of an antibiotic being used? Do we need to make additional changes? And what changes have been implemented and how this may impact antimicrobial use? So that's something to think through as well. And then finally, including recommendations for future improvements. This really provides a great platform for you to be able to say, you know, we're doing this and we're seeing this actually changing, but here's some things that we may need a little bit more improvement upon, and make a recommendation. That way it's something that you can talk through and decide if it's worthwhile to make that sort of change. Additionally, it's important for you to, when you share this information with frontline staff, ask them what their thoughts are. If you do make a recommendation, ask them, what do you think? Would that be a good way for us to implement this? Or what have you seen and how could we potentially implement this into your work? Let's talk a little bit about communicating and what you're communicating and what measure you're actually going to be sharing. So when looking at the NQF core element 6, which is really where we're focusing today, the majority of that is what we're going to hit on today. So this element focuses in on reporting information on improving antibiotic use and resistance, and then sharing this information with prescribers, nurses, and other relevant staff. Additionally, this measure focuses on the success of informing frontline staff, specifically looking at direct patient care staff, and sharing those reports on antimicrobial agents with them. So really the key to success here is not only to be sharing with leadership and prescribers, but also with frontline staff, as oftentimes they will be the ones that catch some things that may need some changing, or they can be ones that help you identify what needs to be changed in order to be successful. So some strategies, and I kind of categorize these based off of the core elements, number 6, and put them into different categories such as steps to visibility. It's very important that we have visibility of reports when communicating this information. There are several ways that we can do this and multiple strategies, and I've just shared a few here. There definitely are other ways that you could do this as well. So some strategies include maybe posting the report on a provider shared web page. This could be on the internet and maybe a commonly visited web page that they're visiting, or if you do have an electronic medical record, potentially posting it somewhere in there where antibiotics may show up. You could distribute the reports via email as another option if you don't have an internet or the ability to post the reports electronically. When emailing, it is key that you provide some background information on the report, as well as how this report could potentially be used to enact change in the hospital. Additionally, you can share information on how to change practice to meet the goals that your facility has set. Another option, as I mentioned, is sharing the reports more widely on the internet. That is a great option. In one of my positions, we actually had the antibiogram for our hospital system, so across our whole system, in the internet. And it was something that anybody could access at any time as a staff member. And it was really useful, especially for me in the clinic setting, to determine which specific antimicrobial agent could be used. And especially if somebody was discharged home, then I had the thought pattern behind why the prescriber prescribed what they did for that particular infection. So that's another great way that you can share that information. There can be public-facing documents potentially on the external website, and this is a great opportunity to be transparent with the community as well as outpatient providers. Again, it's really helpful to have that information when you're in the clinic setting. And then there's also, it's really important not only to communicate these reports, but also, like I said before, next steps, and encourage two-way communication. Encourage your healthcare professionals to ask questions, provide suggestions on how to best improve not only communication, but the reports themselves. They may take a look at the report and say, this is not useful for me because I need to know X, Y, and Z. So making sure to have that open communication is extremely important to making sure you're communicating the correct information to them. It is also very important that these reports are meaningful for the healthcare professionals. So gaining their feedback will assist in providing the best information and the most useful information for your healthcare professionals in your hospital. Another strategy is to integrate this into your current communication, and this may be the easiest way to start off with some of the reports as you create them, but integrating them into current things that are being pushed out. So sending reports at standard intervals to key staff through potentially your P&T committee. That's one way you could be sharing this information. This can also guide the hospital formulary to which antimicrobials are most often used and are most effective, and that can be a great tool for the P&T committee to determine what should be on the formulary. You can also share this information in the patient safety or quality staff meetings to guide therapy and receive feedback on how to improve the process or quality information that is currently available. You could leverage your hospital board to keep them posted on the reports and what's happening when the antimicrobials are being used. You could also present reports at existing meetings such as the medical staff or hospital board meetings That can really provide insight into the current use of antimicrobials, and it also gives you a platform for feedback on how to better utilize these reports. You could share the reports with medical staff at a staff meeting if they wanted to potentially provide some feedback, or even with frontline staff if they have a regular meeting, just even popping in once a quarter to get some information from them. It's also key to engage leadership, and one way to do this is to present at a leadership meeting on really what we are doing and why we are doing it and why we need stewardship. So there are definitely other ways that you could share this information into your current communications. Potentially you have a newsletter that you could share this into, and just consider those different communication strategies that you already have available and how you can potentially implement some of this antimicrobial work into that communication. When we look at expanding communication, so you already have your current strategies in place, you could potentially expand some of this communication and hold quarterly staff meetings with your antimicrobial stewardship program group. It could be just that group, or it could be a broader group to the whole hospital if that's something you would like to do. And having that standing item on the agenda. So make sure that it is expected to be addressed at that quarterly meeting. That also gives you an opportunity to do regular reports, make recommendations, and ask for feedback. If you have a facility newsletter, like I mentioned, you could include antimicrobial susceptibilities. You could talk a little bit about what you're doing in your antimicrobial group, as well as sharing tools to improve antibiotic use. So that's a great way to get the attention, as well as provide some solutions to some of the things that we are working on. It's also a great place for you to share your wins and successes that you've had in the facility. So that's another big piece, is making sure to go back and share what worked well and what is going well and what's changing as a result of the work you're doing. And then lastly, you can encourage the early adoption of reporting to the National Healthcare Safety Network Antimicrobial Use Module, and they will actually send you back a report on the SAR piece of the measurement. So that's a great way to have some return on investment when you do end up reporting there. Of course, there are additional ways to expand your communication. Be creative. Make sure you're asking for feedback from providers and frontline staff on what they need and what's been effective for them. And then a more directed communication is always a great way to share some of this. And we heard this in the beginning from some of you, that you are talking directly with your providers, or you're sharing this information with your providers. So this could include creating and sharing unit-specific reports. It's a great starting point with reporting and communication. So you can look at one specific unit and really work out the kinks and determine the best way to communicate by piloting some of this. Another option is to post reports, tools, and suggestions in a visible place on the unit. So they may have a bulletin board that is frequently visited. By doing so, you'll be reminding people of this work on a regular basis. One of the key pieces with that, though, is that you need to update that on a regular basis so it doesn't become a norm on the board that people kind of overlook. So making sure to have that updated. You can also target specific providers. So consider those that might need the most assistance with antimicrobial selection, or those that seem to have the highest rate of patients that have infections. By targeting these groups, again, you could pilot the best way to elicit change. It also might give you some initial spots that we may need to work more closely with, such as surgical, UTI, or skin infections are all great places to start. Sharing the information and data with the leadership team and the C-suite is imperative for change. It's one thing I really encourage if you're not talking to leadership already, which I believe you all are as a part of this project. Definitely make sure that you're having that regular communication, and that will also really provide not only support, but potentially give you some options for different changes that could be made, and that can help from the top down to make sure that those who are on the front line are really using some of those changes and making a difference in that. Let's talk a little bit about overcoming barriers. There are many barriers to communicating this work. And through this section, we'll kind of talk through the barriers and potential solutions. And this is not all inclusive, but hopefully it can provide some guidance and anticipation of the barriers you may encounter when you do start doing some of this communication work. So first, let's take a look at the barrier of lack of trust of data and results. This may be because the healthcare providers are not familiar with how the data is collected or how results are measured. So trust takes time and consistency. Do not give up on it, and just make sure that you are continually communicating with them on this. Some solutions that we could try is ensuring that you have experienced experts that are not only pulling the data, but also interpreting the data. So that analysis piece also requires you to have those experienced experts. And this is something that internally IHC could even help you with some of this data analysis if you did need additional assistance. Make sure that you share who the experts are that are pulling this data, creating reports, and then interpreting the data. By having that, that expert focus and letting them know that it's not just one person in the hospital that's pulling all of this, but you have somebody dedicated to this will really help gain that trust. If available, it's also helpful to add risk adjustments where possible. This will make the data more credible, and it will remove any concern that this doesn't apply to the population that the healthcare professionals are serving. And then highlight the successful improvements and strategies to achieve those successes. That can help with credibility as well as provide a realistic element to this, and continue to highlight the successes that pertain to your facility as they come about. And then lastly, having peers share successful reports and strategies with specific departments that you may want to implement this work into. That's a great way to get it moving into another area that you may not currently be in. Another potential barrier is the lack of consistency in reporting. So consistency is key to establish that rapport and trust. To achieve this, establish expectations on the frequency of the reporting, like we mentioned before, quarterly, annually, and when the reports will be released. This consistency will build credibility and trust amongst the healthcare professionals. Also, it's important to be educating and reinforcing expectations that will help build additional credibility and trust. And be sure that you are educating regularly. That may be once a month, it may be on a quarterly basis, just providing that education to your healthcare providers so that they can best do their job. Yeah, and then we had a question come in the chat asking about risk adjustment. So this could be something that you're looking at a population level, and that way you can take maybe your elderly group, separated out by age, your pediatric group, and really know where that's happening within those areas. You could also separate it out by unit, and knowing that the skin unit or the burn unit tends to have a higher rate of infection, and pulling those specific data out for that unit so that you know, okay, they're more likely to have a higher rate of infection than the rest of the hospital. So that's kind of what I mean by risk adjustment, is looking at it at a more patient population level. Thank you for that question. Another potential barrier that we see is that people may see reporting as punitive or a punishment. So some may interpret the need for reporting as reprimanding, or they're not thinking of it from a process improvement standpoint. So ensuring that the correct language and a positive message is portrayed will help prevent some of this. Some potential solutions to this: sharing stories that resonate with the clinicians on the measures that are being used. So success stories are extremely powerful and can give you a good basis of why we need to do this work. It also provides hope, and it encourages healthcare providers that they can be successful as long as they continue with the work. Another option is to focus reports on actionable items. So looking at compliance with treatment guidelines and recommendations, that will allow for a little bit better reporting. Again, focus on non-threatening language when discussing reports. Positive language and a focus on the potential for improvement and how the data will be used will be better received than "you must report or else." Another thing to think about is healthcare professionals tend to be lifelong learners. By presenting some of these opportunities as learning points, they will be more likely and willing to tackle some of this work. And I know that may not be true for all, but that does tend to engage them a little bit more. Or if you're even able to create some sort of education with continuing medical education attached to it, they'll be more likely to want to learn that information. Another potential barrier that we see is the timeliness of reports, especially when we're looking at antibiograms or other areas. That can be really challenging if we don't have the reports in a timely manner. I know we all get busy with things and things fall off to the side and may not be the top priority, but reports need to be shared regularly, need to be updated regularly, and interpreted on a regular basis in order to really show the urgency of this work and also to show that this is important work. One way to remedy this is to tie reporting to syndrome-specific reports. So, for example, if there are measures that you are required to report on regularly, such as community-acquired pneumonia or the rates of influenza in the winter, tie your reports to this. and you will be more likely to get them done. I also encourage adding the report to your calendar if you utilize your calendar on a regular basis, like I know we do here at IHC. That way, it'll be a reminder to pull that report and also put on there when you should communicate that report. So maybe it's on the 20th of the month you pull the report, and on the 30th you're communicating that. That's a really great way to make sure that you're keeping up with your reporting. Another barrier is the lack of expertise in analyzing the data and developing a good reporting structure. So the solution to this is really to include, like I said before, expertise from other groups that are experienced in generating these hospital quality data reports. And IHC can help with some of this if needed. Please reach out to your improvement advisors or coach for this project to receive some additional help if you do need so. You can also pull from experience within our HIIN network, take advantage of those who have been successful, and pull best practices from them. There are several hospitals that have successfully implemented antimicrobial stewardship into their facility, so communicate with them to learn what works for them and what you could potentially use to make your project successful. And if you're not sure who those are, work with your improvement advisor and they can help you identify a partner to maybe reach out to and talk through. You're also in a great position by being in the fishbowl to talk with each other to identify the best way to overcome a lack of expertise or other challenges you may be facing during this project. Another barrier is the overwhelming amount of data that you could potentially collect, and this can cause almost a paralysis where you're just not even sure where to start. So ways to overcome this is to target the top infection as your first priority. Break it down to the basics and focus on the most common issue. Then once you have a handle on that, you can expand it to other areas. Additionally, you can start in one unit, like I mentioned before, and expand from there. You could identify and focus on a specific measure or a certain number of measures, maybe just a couple, that can be easily understood and easily pulled to share with your team in the hospital. Or you could even just focus on one outcome at a time. No need to try to do it all at once. Really focus in on one area and then expand as you start to gain more confidence and understanding of those areas. So one successful communication mechanism that I have found and a successful way to engage change across your system comes from the Cotter's 8-step process of successful change. And if you have not heard of this before, it's a really short, easy to read book. It's called The Melting of the Iceberg, I believe. If you want more information, I'm happy to share the name of the book and the author, but this is a really great way to enact change and increase communication. You probably are already doing some of these things, so I just wanted to provide a quick overview of how you can enact change and what communication can look like. And then consider as we go through this which step you are in and what you may need to do to elicit change as the next step. So this is broken down into 3 separate sections. The first one is setting the stage, and this is integral to starting this process. This includes creating a sense of urgency, and you have likely already started this process by being a part of this project. And so you've probably already completed this step. In creating a sense of urgency, you want to state why a change is needed and how this will impact both patients and provider groups. One thing is a lot of times when we go through change, we start with this creating a sense of urgency and we never come back to it. So making sure to continually restate the importance of this project and the work that you're doing will help keep momentum going. The second step is pulling together a guiding team, which you've already done, and that really helps that team continue to work together. Do note that that team may evolve or change as you go through this process, so make sure that you're pulling in additional team members as needed if a team member leaves or if a team member is no longer a part of that team. The second area is deciding what to do. Again, you've kind of already done this. Develop the change vision and strategy. Again, you've done this. And then following today's webinar, I really encourage you to identify which reports you want to use and how you want to use them. So now that you've already done the larger vision and strategy, start thinking about reports. What do you actually want to do and where do you want to move that? Then you can determine who these reports need to be shared with and how to best understand them. So although you've done the larger vision and strategy, start thinking more specifically about which reports you want to share, and that will be the first step in starting to communicate those. So the last section is really make it happen. You are likely in this phase at this point, so let's make it happen. This is really where the rubber hits the road. So like we discussed today, communication is absolutely key. There needs to be clear and concise messaging coming from your team on what you are working on. I like to term this actually the elevator speech, and I'll share an example elevator speech with you when we get to the antibiogram shortly here. It is important to have this practiced and refined, so at the drop of a hat, you can really share with a provider, a patient, a healthcare staff member on why you are doing this work and what you are doing around antimicrobial stewardship. You're likely familiar with the team steps from AHRQ. It's a great resource that can walk you through some different communication methods as well. The fifth step is empowering others to act. So be sure to remove as many barriers as possible and encourage others that are interested in this work to engage and make the difference they want to make. And then always, always, always tout your successes. No matter how small, sharing those successes and celebrating them will keep the momentum moving and ensure that you see progress. And especially as you start communicating these reports, making sure to share those successes will really help. And then of course, don't let up. You will encounter barriers, keep pushing through and keep moving, especially as you start to communicate. But you will see success if you keep pushing this. So that's kind of the main steps to change. And then the last step, the real last step, and this is what you all are working to do, is to create sustainability. So creating a new culture, making sure that this does stick and something that continues on even after this project. So keep pushing and make it the standard of care. So now in the last bit here, I just wanted to go through Antibiogram and use it as an example of how we could potentially do some of this communication. So I'm going to describe it at a high level just to help you better understand what an antibiogram is if you don't already know this. So it really is a tool for healthcare professionals to guide empiric antimicrobial or antibiotic therapy for susceptible bacterial infections. And when I say that, that really is our initial dosing of antibiotics, whether or not we know which bacteria they have. We also call it a profile of antimicrobial susceptibility for common bacterial pathogens, so specific to your hospital. And then it's typically generated by data that the laboratory has and pulling that from the hospital or the healthcare system. Of note, with antibiograms, it must be at the facility specific level. Even if you're in the same town or the same city, your facility likely cares for a unique patient population, and that can really alter the way that your antibiogram looks. So making sure that you're looking at specific facility level data. And I know Michelle mentioned at the beginning, and something that we hear commonly is that it's difficult to generate one because you don't have the numbers if you're in a more rural or critical access area. So I like the way that she mentioned doing that on an annual basis, but also looking at some other antibiograms from the state in order to get an idea of what our state looks like as well. That can be helpful. So why develop an antibiogram? Your facility may not have one yet, and that is completely okay. That's one of the steps that you can take through this project. But an antibiogram really encourages responsible use of antibiotics across the facility. Again, it helps guide that first initial antibiotic dosing. It can detect changes in resistant patterns. So that's really important to know if we have some changes in resistance in the area so that we can change our therapy accordingly. And it's actually quite inexpensive to do so, and it's pretty simple to develop and maintain as long as you have the numbers that you need. And then there's several reasons that it's beneficial beyond this to have an antibiogram, but really the big focus is that it helps guide that prescribing so that we have the correct drug to affect the correct bug. Some questions to consider if you are working to develop an antibiogram is what will you need to create it? So going back to data and trying to make sure that you know what data you want to collect to create that. How do you interpret your antibiogram? And that could be a whole webinar in and of itself, but we're happy to work with you on that if you do have questions, as well as your coach can help you through some of that work as well. How will the antibiogram be implemented into your facility? So thinking through that communication piece, where you want to have it used, how it's going to be used, and then how you measure its success, and then how often you want to update it. So again, just like anything else, this is going to be monthly, quarterly, annually, whatever works best for your facility. I did want to highlight the Clinical and Laboratory Standards Institute. They have published a guideline called Analysis and Presentation of Cumulative Antimicrobial Susceptibility Test Data. It does have a cost associated with it, so just keep that in mind. It's about $180 to purchase, but it does describe methods for recording and analysis analysis of an antimicrobial susceptibility test data. So it walks you through what data you need, how to really bring that data together and how to sum it up, and then how you can really look at susceptibility patterns or clinically significant microorganisms. So that's out there as a great guideline for you, but it does have a cost associated with it. So now let's talk a little bit about reporting the antibiogram. How can you get this out to your healthcare professionals, your frontline staff, all of those pieces? This is meant to be an example of everything else that we talked about earlier. So one way to get the antibiogram out there is to educate. Getting that out there in staff meetings, having specific education set aside for it. Again, if you're able to get some sort of continuing education tied to it, that tends to get more people there. Or food. That's one thing I've noticed is if you bring in pizza or something like that, people tend to come to those education sessions. Make sure that you're sharing this widely. So be talking about it, sharing it with different frontline staff, providers, asking them for their feedback. That's really key to continue to share it as widely as you can in order to get it out there. Communicate the purpose and benefit to patients in the community. And I'll show you an example of an elevator speech I could potentially use if I was in your position and trying to push this out. Identify your champion. If there is a physician, a nurse practitioner, a physician assistant, or even a frontline staff nurse or MA that is really excited about this work, identify them and have them do some of the communication. By not having it come from that direct team, it will be more well received and people will be more interested in really getting involved in that work. Make sure that you're sharing at regular medical staff meetings or committees. We kind of discussed that, so bringing it to the forefront, not only what it is, but how it can be used and how it can really improve treatment at your facility. And then make sure, again, you're sharing with leadership, which you should be doing throughout this project already. So one example of communications is your elevator speech. And this is meant to be a very short speech that you could share with somebody as you're going down the elevator, maybe a few floors. So keep it short and sweet. And that's something that I go to when I'm working on any project, is knowing that I have an actual elevator speech and that I've practiced it and that I know it really well. So one potential way that you can talk about an antibiogram is our facility has created an antibiogram. This is a living document that has reviewed culture and bacterial susceptibilities to antibiotics. When choosing empiric therapy, we encourage you to utilize this document to make an educated use of antibiotics. So I described what it is, how it can be used, and what benefit it provides. That's really the core elements of your elevator speech. Another way that we could potentially do communication is education on ideas. So in services, discussion at clinical staff meetings, newsletters. Newsletters are a really great way to get that information out. Like we said before, I could post this on the bulletin board, maybe have a fun little graphic that shows that we are working against these bacteria and we're working to use this antibiogram to identify the correct therapy, or even having mandatory annual education or have it a part of your hiring process is another great way to get that education out there. We've already talked about posting it on the internet so it's easily accessible, or another area that your providers are regularly using, and then updating it on a regular basis. One of the key things with communication is that you need to re-educate. So you may tell somebody something once, you may tell them a second time, and it still may not stick. So going back and continually re-educating is really key in order to provide the best possible education and best possible communication that we can. And with that, we welcome your questions and comments in the chat. To submit a question to me, my email address is there. It's derrs@ihconline.org. I'm always happy to help with anything I can and absolutely happy to answer any questions you all may have. And Kate's going to come right back in on this.
So as we open up the Q&A, certainly to the hospitals and the fishbowl and to others through the chat, I just want to pause. We have a couple members of our project team joining us on the call today, Jeff Brock and Terry Hewlett. If I'll go ahead and open up the lines to you and offer you a chance to inject your reflections and ideas about today's content on reporting. Jeff or Terry, if you're on the line, go ahead and unmute.
This is Jeff. Nice presentation. I thought it was very thorough. I'd be happy to answer any questions about what we do. I don't have any specific comments other than very nice presentation.
Jeff, would you have any suggestions specifically for smaller hospitals? I know you work with the Mercy Health Network at times, as far as if they don't really have anything formally in place for reporting back to providers and frontline staff, what might be a suggestion that you have as a starting point or a basic way to get started with reporting?
Yeah, it's a really good question. I understand the challenges with small sample sizes. A lot of these critical access hospitals may only have 1 or 2 patients a week on antibiotics. What I've suggested in the past is starting with an area of need. So if you do a lot of outpatient surgeries where you're seeing, let's say, maybe some inappropriate antimicrobial prophylaxis habits from your surgeons that are coming to your facilities, do like an MUE type of activity. Evaluate what's going on in your hospital with, let's say, surgical prophylaxis, compare it to guidelines, and report that back to medical staff and the hospital administration as a way to help implement change. So I found that to be a useful strategy to do, evaluations, reporting that data back to the staff, implementing education or a new protocol, and then reevaluating and report back the positive impact that you had.
Great suggestions. Thanks, Jeff. And so I think what we'll do is we'll turn to the fishbowl and give you all an opportunity to reflect back on what's maybe one thing that you've learned from today that you might try and take back to your teams and move forward with as far as implementation. And I think this time we'll go ahead and start with Clark County. Michelle, are you on the line?
We are. Well, we've been chatting. I think that we're definitely going to take a look again at what and how our antibiogram is reporting and what it's reporting to make sure we all understand the scope. Because we were talking about one of the challenges we think we might have is that such a large number of our local cultures are not hospital-based, but are from the local nursing facility. And although those patients can end up being admitted here, I think that subset, and we were talking about how that subset is really unique in its own facility. Like we were talking about ESBL producing E. coli as if you pull that facility out, what percentage that represents compared to the common population in our area. And I think we were just talking about we're gonna have some challenges figuring out how to slice the data and how to report and which of those to use. So we're gonna take that back and figure out what we're gonna do.
Great, Michelle. Thanks for sharing, and would just encourage you to leverage your coach as you do that. And also, Jeff might have some thoughts, and I know Dr. Castagnini from our team, that's an area of expertise for him. So if there's something we can do to support you, please let us know. Let's turn now to the Virginia Gay team. Any thoughts from you all?
I guess I would echo kind of what Clark County had said in reviewing our antibiogram and figuring out how to sort that data out and make it in some sort of a presentable way. That's going to be our biggest hurdle here, and hopefully our mentor can help us kind of sort that out a little bit.
Yeah, great. It definitely is a challenge. And Jill, are you there with us still?
Yes. So
What do you guys think?
our biggest thing is once we get this data collected is making sure to bring it to our med staff meetings on a regular basis and keeping them in the loop on and asking for suggestions on what they think, how we can improve on what we found in the data. So
Yeah, I think those are really good points. So audience, consistency, and really asking for their feedback. Because, you know, sometimes when we ask, we're not always, we're often surprised rather by what they say, you know. So when we ask for feedback, we kind of open a door to learn more about what they need and why they need it and what's beneficial from their perspective. So I think those are all great thoughts. And I know, Sarah, apologies, I know you've had a little bit of connection trouble today, but if you're with us, any reflections on how you might take some information back from today? We may have lost Sarah. I know she's had a little bit of trouble connecting today. She's been working with us offline. So, well, I appreciate you all willingness to share your thoughts. It's, I think, certainly helpful for others listening along. We're approaching the 12 o'clock hour, so I want to leave you with some next steps. To ask you to email your assigned coach this week or in the next business week with some available times that you have to meet with them this month. Sounds like there's some work that can be done around antibiograms. We'd like you to start, right? Jump in, figure out what you can move forward with as far as, oh, we hear somebody on the line. Go ahead and mute your line, Jill. There we go. As far as what you can move forward with in regards to reporting information back to your healthcare teams and your organizations. Make sure your team is registered for webinar 4 that's coming up on October 17th. Dr. Castagnini will be presenting on optimal prescribing. And then contact myself, Kate Carpenter, with any project questions you may have or concerns that I can assist with. Thank you all for joining today and have a great week.
Thank you.